electronic health record with the inclusion of not just financials and not just some of the operational needs that we have, and certainly the clinical record that we're creating, but the compliance record that we create there is an enormous assist to us in ensuring. We don't even say compliance anymore at NHS, we say integrity. That we are a company that stands for integrity, that integrity is a hallmark of our going forward, whether it's interaction with our families, our consumers, or quite frankly, each other, how we create a bill, that we want to be a company that stands for integrity. And the Avatar platform, along now with myAvatar, has ensured us, and Netsmart's been very innovative along with us in creating some of the application that we have built into that to give us that guarantee going forward.
Integration of Avatar into our organization has only enhanced our compliance program. It's allowed us to put staff on the same consistent documentation across our entire organization. So someone in New Orleans or Philadelphia or New Jersey, they're all doing generally the same treatment plan and they're writing the same progress notes. And it allows for very consistent capture of data and to make sure that all the things that we're looking for in a good treatment plan are there. It also helps us because it has a lot of safeguards in place so that we're not billing claims out the door that we shouldn't be, making sure they're covered by a treatment plan, that they have an accurate progress note written, that they meet all the criteria that the payer wants to see before the claim even gets to them. So Avatar has done nothing but enhance our already award-winning compliance program.
Avatar set the minimum standards. Having myAvatar, the settings say we won't bill without a progress note or treatment plan being in the system. So that's a huge step forward from the days of file cabinets, and I hope there's treatment plans, and I hope there's, but in a clinic of any real size, can I realistically, like I'm the only administrator, can I realistically in a clinic that has 750 or 850 outpatient consumers, am I realistically going to go and check every treatment plan that comes through, and how am I going to know who got seen today and didn't have a treatment plan? And I have a great admin staff who works very hard, but things are going to get through. And I also think it adds accountability as a clinician. So my staff knows that I'm going to find out if they didn't do a treatment plan, because it's going to end up, it's not one you can hope I never look at that one in the drawer, or you hope the auditor doesn't pull that chart. This is, it's all open to me, and we have a global monitoring program that we do where I audit a certain number of charts every month. I do some of those for every clinician we have. I do the med management stuff. I'm reviewing those to make sure they have all the elements they're supposed to. But I think we don't have a lot of problems because the clinicians have taken that on themselves. They know that they have to have treatment plans and progress notes. Otherwise, there's accountability. I'm going to get an unbilled service report that's going to say, this didn't bill because of this problem your clinician did or this problem, and I'm going to come to you and say, explain to me what happened here. So once you go through that process in the beginning, they understand that this is just something that becomes part of your culture. Like, you just have to do this stuff, and they're starting to understand that it also drives good care, and so that's the important thing.